These abbreviations are used during the video.
Begin with a transverse scan over the head of the hip. Identify the muscles in the scanned region. The iliacus muscle has a lateral and medial portion. The medial portion, together with the psoas, forms the iliopsoas tendon, indicated by an arrow. The lateral portion contributes to the tendon at the medial edge of the muscle, marked by a star. The iliopsoas tendon is positioned directly over the joint capsule. Gradually move the probe cranially until the lateral anterior inferior iliac spine, AIIS, becomes visible. The AIIS is the first bony structure that appears when moving the probe cranially. Note that the AIIS is located slightly lateral. After identifying the anterior inferior iliac spine, AIIS, using ultrasound, proceed with the lift technique by moving the probe from cranial to caudal to locate the rectus femoris muscle and its tendon. The direct rectus femoris tendon is observed forming a cap-like shape over the AIIS. It is important to recognize that the large muscle mass lying beneath the triangular sartorius muscle on the medial side is always the iliacus muscle. Once the direct rectus femoris tendon is identified, turn the probe 90 degrees for a longitudinal scan of the tendon. After identifying the rectus femoris tendon, the ultrasound probe is oriented longitudinally along the tendon for further evaluation. In this view, a hypoechoic shadow becomes visible, representing the indirect rectus femoris tendon. This hypoechogenicity results from anisotropy due to the tendon's fiber orientation and will be further assessed later. Subsequently, the ultrasound probe is rotated to a transverse view over the direct rectus femoris tendon. The tendon is then followed distally until the muscle belly becomes visible. Note, the arrow marks the anisotropic shadow of the indirect rectus femoris tendon. The tendon is then followed even further distally until the muscle belly becomes fully visible. The indirect tendon appears as a ribbon-like structure shaped like a comma, indicated by an arrow. Note that the muscle belly of the indirect tendon is forming medial to the comma. On the other hand, the tendon of the direct rectus femoris is forming lateral and superficially the comma, marked by a star. At this level, the circumflex artery can be observed beneath the rectus femoris muscle. Deep above the femur, the iliac muscle and the lateral vastus of the quadriceps muscle can be seen. The ultrasound probe is moved proximally in a transverse orientation over the rectus femoris tendon. This maneuver continues until the hypoechoic shadow of the indirect tendon becomes visible once again, now appearing in cross-section. Once the comet-shaped anisotropic tail becomes visible, the anatomical structure can be re-evaluated. At this level, note that the gluteus minimus muscle is positioned lateral to the rectus femoris tendon. located lateral to the tail. To better visualize the anisotropic portions of the indirect tendon, the ultrasound probe must be shifted laterally. This maneuver ensures that the indirect tendon is once again visualized orthogonally. The indirect tendon is then examined from the lateral side of the thigh and followed proximally to its insertion at the acetabulum. Watch how the probe is shifted laterally and at the same time orientated parallel to the indirect tendon. The tendon stays anisotropic until scan exactly orthogonal. Once the origin of the indirect tendon at the acetabulum is located, the overlying muscles can be identified. Note that the gluteus minimus muscle forms an eccentric tendon at the surface of the muscle belly, marked by an arrow, whereas the gluteus medius muscle, located more superficial to the gluteus minimus muscle, forms its tendon centrally within the muscle belly, indicated by a star. When the ultrasound probe is rotated 90 degrees at this level, a cross-sectional view of the femoral head is obtained, showing the labrum and the indirect tendon in a transverse scan, indicated by an arrow. The muscular layers overlying the indirect tendon correspond to the gluteus minimus muscle, deep, and the gluteus medius muscle, superficial. It is important to note the close anatomical relationship between the origin of the indirect rectus femoris tendon at the acetabulum, the labrum, and the joint capsule.